Hi, I'm Amy with the New Westminster Times. This week we're talking healthcare. Canadian healthcare is on all of our minds and not for good reasons. We are seeing a discourse shift in this country as swaths of us are realizing that our healthcare system, which was once touted as one of the best, if not the best healthcare system in the world, is really not all that it's cracked up to be. It's not good, and when we're looking at how much we're paying in our taxes and just how expensive it is to live in this country right now, it certainly doesn't feel like free healthcare anymore. We've got ER closures, we have wait times even for cancer diagnosis and care, we have patients that are being sent to the USA to get imaging done that can't be accommodated in our own system. Canadians are dying not only on wait lists, but in our emergency rooms. So just a few days before Christmas, this 44-year-old Edmonton father and husband, Prashant Sri Kumar, died in an Edmonton emergency department. His wife says he waited for 8 hours with chest pain before he collapsed and died. He could not be resuscitated. And this isn't a one-off story either. Just a year before that, 39-year-old Adam Burgoyne, who's someone that I happen to have known, went to a Montreal emergency room with chest pain. He tweeted about the fact that he was leaving in frustration after 6 hours of waiting, and Adam died the next day. He had an aortic dissection, unfortunately. So even Elon Musk ended up commenting on Adam's death after it went very viral online, and yet a year later, here we are again with another story that's being heard around the country, around the world. Nothing has changed. I talked about a shifting discourse in healthcare. I saw this interesting news story just yesterday that I think sort of exemplifies what I'm talking about here. So this is a story that also happened right before Christmas. A family in BC had a strange man delivered to their home from the hospital. So the woman who answered the door would have been expecting her father-in-law to be dropped off, but it was just some random elderly man dressed inappropriately for the cold and very confused. The transport company took him back, of course. The woman's father-in-law was still waiting in the hospital with her husband at his bedside. And when I say bedside, I'm of course referring to a stretcher in a hospital hallway. What did you think? We actually have beds for all of our patients? Yeah, right. So, I can imagine a world in which this healthcare story would have been framed by the media as sort of a quirky human interest story. Maybe these two families would get to know one another and we could all laugh about it. Of course, the way that it was actually framed by the media is as just another failure of our overburdened, non-functioning healthcare system. So this is what I mean when I'm talking about a discourse shift. We've moved beyond this point of even pretending that our system is simply not falling apart at the seams. As some of you know, I spent 13 years as a registered nurse in public health care with Vancouver Coastal Health. I've worked in hospital mostly and a little bit in community. I've worked on the front lines and as a head nurse and as an educator, so in supervisory and management positions. When people talk about nurses being the backbone of our healthcare system, they're really not joking. It's not so much a compliment to nurses as it is really just the observation about the sheer number of us compared to the other healthcare disciplines. On any given hospital unit, you're going to see way more nurses than there are physicians or any other healthcare professionals. So nurses also typically spend the most time with patients. As such, their experiences are, in my opinion, a significant indicator of the health of our system. Nurses are sort of like a canary in the coal mine. And at this point in time, the canary is about to drop dead. Nursing schools in Canada are seeing their enrollment tank. I know this to be the case at several schools, including BCIT, the BC Institute of Technology, which, along with UBC, the University of British Columbia, is one of the two coveted nursing schools to get into in this province. Before I left my job in healthcare, the nursing instructors I knew from BCIT had been sharing with me that the program was seeing plummeting enrollment and they had empty seats, which has never happened before. This is at a school that was highly competitive. For gaining entry into it, they've historically had wait lists that have been years long, not anymore. Another example, in 2023, Camosun College told the media that their nursing program had empty seats. And again, they had historically been slammed with too many applications, more than they could handle. At one point, they'd get about 600 for their 160 seats. And in 2023, they couldn't even fill those 160 seats. This is in addition to the tens of thousands of vacant nursing jobs in Canada. The Canadian Nurses Association is estimating that we will be short 117,000 nurses by the year 2030. Stats Canada has identified the nursing profession as having the highest vacancy of any profession in this country. And then there's one Canadian think tank, the Montreal Economic Institute, that found that for every 100 nurses who graduated in the year 2023, 40 of them had left the profession by 2025. So this is a profession with relatively good wages. You got pension, benefits, good vacation time. None of these things are making up for how bad it is to work as a nurse in our healthcare system. That said, I think it would be interesting for the public to sort of know some of the comments that are typical in these online groups that are for nurses, registered nurses, licensed practical nurses. And this is from the province of BC. So this is a group I hopefully won't get booted from for sharing, but I do hope, because I'm not naming who these people are, I'm not sharing where they work, that this will kind of keep me safe. And also, I deeply care about the nursing profession, and I really want to see it turn around. So we'll see what happens. In any case, I think the public does deserve to know the sort of run-of-the-mill sentiments that are being held and shared by members of this profession. This is a profession that has a profound impact on the well-being of our population. We all have a vested interest in ensuring that the nursing population and nursing profession is well-run, full of competent, well-taken care of members. These are the people they're going to be caring for our loved ones and for ourselves during our lives or at the end of our lives. It affects literally every Canadian. So let's dive in to some of these comments that I found. And I'll just mention, these are posts. I only had to skim a few pages. Almost, I'd say every fifth or sixth post in these groups is a nurse complaining about the conditions of work, her mental health, being assaulted, that sort of thing. So this doesn't go back very far at all. And that's how often this sort of thing is shared. So one nurse said, quote, "I'm struggling at work with my mental health. I work at a needle exchange and I'm experiencing compassion fatigue big time. There's been so much workplace violence from clients and even other staff. I've reported it all. I have no family doctor. I'm looking to get a medical note to get some time off. Has anyone had any luck using a virtual clinic to get a doctor's note for medical leave?" So here are some of the replies to this nurse's post. 1, "I've been on WorkSafe leave from my job in the downtown east side since May 2025. The process was pretty easy to get diagnosed with PTSD from the psychologist that they set me up with, and then I got therapy covered 3 times per week and wage loss benefits." Here's another one. "I work in a similar community setting / overdose prevention. The first year was so tough. I thought I could save everyone and put so much of my heart into people to the point where I thought I was going crazy. Have seen so much death and violence directed at myself as well. Always file WorkSafe complaints, whether it's a physical threat or just verbal. That's the only way things will change." Another response, "If you have the strength to do the WCB way, it's great, but I wasn't strong enough. I kept blaming myself and didn't know how to articulate what was going on for me. I took a leave instead. I'm on disability now through Canada Life. It's been 1.5 years. I've learned that it can be a long process to get back to health." Another reply, "If I may suggest also getting in to see a psychologist. I work in constant trauma, and after 20 years, the PTSD is mounting. I wish I had gone sooner, but we all know we put our needs last." Okay, so here's another, this is a comment on a post that was about violence against nurses. So someone replied, "I'm tearing up just looking at this. Things need to change. Pain and suffering on our end is normalized for so long. Unless we start to push, we'll keep losing and things will worsen on all fronts." Here's another post. Hello, my fellow beautiful nurses. I don't know about you, but I'm tired. As a single working mom raising 3 little boys and an RN since 2010, I had to start a business on the side so I could stay at home, not worrying about childcare payments and arrangements. And I'm still tired. Failure of health authorities helping with childcare, failure of upkeep of appropriate nursing ratios because of ambiguous and non-binding language, referring to contract language. A failure to upkeep and maintain our benefits, tired of being denied days off at straight time coverage only, tired of asking for a vacation, tired of not being able to book a massage. It's been about 3 years because my life work is chaos, tired of swollen ankles, compression stockings, and work-related injuries not being covered under WorkSafe, tired of learning new software programs with no reprieve or financial motive, tired of orientating and having higher responsibility without fair compensation. So she's referring to the fact that a lot of nurses here are constantly orientating new staff or students to a job. And in my experience, if you're doing your job and you're training someone to do your job, and quite often these are people who leave the role within days, weeks, or months, and then it starts over again where you're training someone new. Going back to her comment, she said she's tired of UTIs, urinary tract infections, from unscheduled bathroom breaks, tired of hypoglycemia from not getting meal breaks, tired of miscarriages and infertility from unregulated sleep cycles and hormone imbalances, the anxiety of not knowing staffing levels for the shift or whether she will be redeployed to another unit, tired of not being able to take her medications for chronic health symptoms that she thinks were caused by her work environment, tired of not knowing how to take my own medications, being threatened with fire, with arrest, tired of non-response from management, negligence of unanswered emails, lack of obedience being attributed to behavioral flaws. And she asked, why is the huge body of nurses passively complying to this type of relationship that we wouldn't allow with our kids or our partners? Why are we consenting to it with the employer? Here's another post and a bit of a rant. This nurse said, I'm at a point where I'm considering a career change. My time working in the operating room has taken a physical and mental toll, and the role no longer brings the fulfillment it once did. I often feel like we're expected to function like robots, constantly rushing to finish cases and turn over patients with little consideration for how exhausted we are. If I could turn back time, I would have approached my career choice differently. While nursing has taught me a great deal, the majority of the experience has been physically and emotionally demanding. And so some of the replies to this woman's post, unfortunately, so many nurses feel the same way, including myself, never-ending, growing political requirements, increasing documentation, changing policies that aren't about patient care. There's little time for client needs, too much mental and physical stress on us. It's too frustrating. I'm rushed all the time. I became a nurse for a reason, not a legal secretary. The mobbing, the judgmental bullying behaviors are growing. Another reply also agrees, said, same, I like doing it and the people I work with, but my body doesn't. The healthcare system is always pushing for more, running ragged, the additional computer work with no change in staff levels for decades. Now they want to take more from us, very demeaning. We make the people higher up look good so they get bonuses. No respect for our profession. It's just a business. They need to take from the top and give to the bottom so we can do our jobs with respect and appreciation. Another person said, I'm in the same boat. The constant stress of the job and adverse effects that go with it are just starting to feel not worth it anymore. I wish I had approached this career choice differently as well. So there's I'll get into one more post. It's long. I won't read the whole thing, but this is a different post called The Silent Abuse of Registered Psychiatric Nurses. So in BC, not every province has psychiatric nurses. BC does, and they are a specialty type of nurse. So if you work in psychiatry, you can either be a regular registered nurse or you can be a registered psychiatric nurse. So this post about the abuse of psychiatric nurses says that mental health nurses are trained to sit with pain, absorb distress, and hold hope for people at their most vulnerable, yet behind the therapeutic calm is a profession quietly enduring layers of abuse that often go unnamed, unrecorded, and unresolved. It has a list of these types of abuse. One is normalized violence and aggression. It talks about verbal abuse, threats, racial insults, sexualized comments, and physical assaults that are frequently minimized as part of the job. It also talks about emotional labor without protection, a blame culture, defensive practice, systemic undervaluation, moral distress, and then it goes on to how we might shift this culture. But, the point that I'm making is that these posts from nurses are extremely common, and the replies some of the replies that I've read here are just as common. And I would have to say, from my 13 years in healthcare, I worked with miserable nurses. I worked with nurses who quit after being assaulted on the job, nurses who use their sick time just so they didn't lose their minds or, ruin their personal relationships, their marriage, whatever. I'm not sure, if I reflect on it, that I could tell you about a single nurse who was happy with her job and with her profession, at least not in any of the public health authorities. So what, as Canadians, are we supposed to do to fix this problem? One solution that I've proposed is sending the bloated middle management bureaucracy back to the front lines where they belong, to alleviate some of this stress and the shortages on the front lines. A lot of the people working in middle management are nurses, hold their professional licenses. They have to have their nursing license to have their management job, but they're not doing any direct patient care. And there are way too many of them. So it would make a big difference if we sent a lot of these people back to the front lines where they're actually needed. Aside from that, I think it's going to be really an uphill battle trying to attract people to work in our healthcare system. When you've got people quitting this profession in droves after spending 4 years in university, in nurses' cases, I'm even longer, double that time and more for physicians, we know that we're in a dire situation. It's really bad. What kind of things do we need to do? We have to change our healthcare culture. Like I said, we need to get rid of this excessive bureaucracy. We need to make the everyday working conditions more tolerable for our doctors and nurses. We also need to address the societal concerns that are overburdening our system, including immigration and birth tourism. We should also be adding private care options, and we should be stopping all of the fear-mongering about having the option for private care. Canadians are dying waiting for care. Just let us have all of the available options so that, the people who can pay for it do. It will be better for everyone. And while we're making these changes to our healthcare system, we're going to need to do something in the meantime to attract people to these jobs. That's going to be expensive. Bonuses, time off, benefits. I think whatever we can do, we should do, because Canadian healthcare is really bad right now, and it's only going to get worse. I think right now we're in the initial stage of this crisis, and unfortunately we are in for some very, very dark days in Canadian healthcare.